Well, hello everyone, welcome back to my channel. My name is Catherine and I post beauty, fashion, aesthetic, lifestyle, a day in the life vlogs. And today I thought of doing just kind of a chill type of video for you guys, sort of like a get to know me. I know that I did one previously, but this time I asked some of my friends, subscribers, readers through Instagram and Facebook page, and I think, if I'm not mistaken, I always lose track of time, but that was last week. I asked, and if you have questions for more, and so we're gonna just start. We're just gonna jump right into it, and hopefully I'll be able to address the questions without dragging this video. Otherwise I will just put probably a segment 1, segment 2. Let's see how it goes. So, what is the best treatment and or skincare for wrinkly chest from past sunburn? Great question, but I'm always about prevention is better than cure. So first and foremost, try your best to avoid or prevent sunburn. So the thing is, and a lot of people do these mistakes, and don't get me wrong, even myself sometimes when I was too lazy, but not anymore now that I'm a lot older and wiser. But yeah, when I was younger, even if I am into sunscreen advocate, is yes, you may apply the highest sunscreen, SPF 50, SPF 70, but technically speaking, the American Dermatology Association can only recommend SPF 30 is suffice enough to block at least 97% of the UV rays, and there's not enough proof that as SPF goes higher, you'll be protected longer. And that's where the most common mistake people do, thinking that an SPF of 75 one-time application 25-30 minutes before going out is enough to be adequately protected. You have to reapply every 2 hours when you are staying longer or whenever you get wet and sweaty. And it's always better to apply it generously, and just because we always have the habit, and it's not only like most people, that's what I'm saying, myself included, although there is a recommendation again that you have to apply at least a shot of glass, 1 ounce, equivalent to 1 ounce, on all the exposed body areas. The tendency is for us to just apply sparingly and then we call it a day. Learning from the mistake of not reapplying, what is now the best treatment from wrinkly chest? Wrinkly chest, I would assume that you were really severely burned, okay? So not just it's gonna be really wrinkly, really dry, but for the most part itchy. That's the sad truth, and for me it happened to me before. So moisturize your skin like lavishly, like generously, and opt for something that has thicker in consistency, something like Eucerin Professional Repair, because badly burned skin from sunburn, severely dehydrated, can also be very, very itchy and prickly. So that's my advice. What is the best professional treatment in at-home solutions for hyperpigmentation? Very good question. So I'm actually, for you guys that are new to my channel, I am getting a lot of skincare, aesthetic concerns, questions, just mainly because on the side, aside from doing all this, doing YouTube or beauty blogging or lifestyle blogging, is just my side gig, because I work as an aesthetic registered nurse specializing on laser procedures, IPL, radio frequency, anything that has something to do with aesthetic, textural concerns, pigmentation and whatnot. Anyway, while I tackle all this textural concerns on a daily basis, know that I will not diagnose you when you ask me questions. If you happen to have questions, okay, I will just give you my own recommendation, but my recommendation should not replace formal advice of your own doctor, dermatologist, your PCP, and all that kind of stuff. Okay, so going back to our question, what is the best professional treatment at home solution for hyperpigmentation? Now, there are different causes of hyperpigmentation, but to simplify my answer is that first and foremost, we have to categorize what kind of pigmentation or hyperpigmentation we have. Are we talking about sunspots? Are we talking about freckles? Are we talking about post-inflammatory hyperpigmentation? Are we talking about melasma? So are different kinds of situations. So my answer would be case to case. Now, what is the easiest to treat? Lighter spots, to be honest with you. Sunspots that are just starting to develop and they're just very light, they can sometimes respond to HA. Alpha hydroxy acid is just like glycolic lactic acid, so look for products that have this. But it's not a one-shot deal. It takes time for these products to work and eventually fade out. 2% hydroquinone available over the counter can also help, but it's quite controversial when it comes to usage, because in Europe it has been banned already, but in the United States we still see a lot of companies and even doctors still prescribing the higher percentage 4% hydroquinone. These are products that can help with uncomplicated simple cases of hyperpigmentation. Now we talk about sunspots. Sunspots result from years and years and years of unprotected sun exposure, thus the name sunspots. Unfortunately, some of those are darker and buried quite deep in the skin, therefore topical products will not work. Okay, and regardless what kind of bleaching, what kind of lightening, brightening cream you use, chemical peels, if you're not careful with sun exposure, you're not using sunscreen, then chances are they're still gonna come back. Okay, that's one important point to consider. Now, what would treat sunspots then? You can go for laser or intense pulse light. Again, it's case to case basis. There are a lot of considerations when I advise, especially sunspots close to my heart. If you see spots that are darker and more spread out in patches, those are not sunspots, and sometimes they just trigger, or sometimes they just appear suddenly in the thick of summer when you're pregnant. That's why it's also called mask of pregnancy. Then you need to see a doctor already or a dermatologist, because that could be an indication of melasma, which is for the most part genetic, hormonal, and sun-induced. So it will be very tricky for you to treat that. You need a prescription strength topical medication for it, combined with laser that can specifically target melasma. Is there at home treatment for nasolabial lines? This one, yeah. If you want dramatic results, then there is really no at home treatment for those. Okay, especially when it is related to aging, which for the most part it is. Let me just say this straight: machines treat, skincare products maintain. So if you are, say, in your early 30s and you're starting to see signs of aging, might as well, and I always tell patients, save your money, go for the big thing, go for the big deal, go for a machine. Radio frequency skin tightening. You can also do radio frequency microneedling if need be, depending on the severity of the wrinkles. You can go for fillers. There are really plenty of options out there. What are the best practices for people who want Botox but are afraid of getting too frozen, eye droop, eyebrow weirdness, etc.? Okay, well, it's all in the number of units injected. Like I said, do your research well. price does not equate to quality. Don't go for the cheapest, okay, but go for somebody that has the most experience, because to somebody who has the most experience, who has injected a lot of patients already, then they know the correct number of units to be injected on particular area. The units that Dr. So injected on your friend is not the same. It's not going to be the same as the number of units that Dr. So will inject on you. So it's always case to case. So do not say, how come my friend was given this unit and then this one is no, I want her units. No, you probably, you know, require less or more. Number 2 is the location. Okay, so take note, Botox Xeomin Dysport is a neuromodulator. So it paralyzes the muscle where you injected it. And the thing is, it spreads out up to 2 centimeters around the area that was injected. Are they permanent? Just in case your injector made an error? No, because it's reversible, but you just have to wait anywhere between 3 to 4 months until your body gets rid of this toxin. Yeah, it is a good toxin. So there you have it. I try my best to cover as much questions as I could. For those that have not been mentioned, I will try my best. Know that I have this on my mind. They're on my list of things to do, just because I don't think it's still gonna be entertaining with a very long and dragging Q&A, right?